Hi, everyone. Welcome back to the What Should You Do podcast with myself, Ellie, and Alex, my co host. Today we have on our podcast Dr. Joshua Feblowitz, who is an emergency physician and medical leader who helps oversee one of Maryland's busiest emergency departments. He also serves as the Associate Medical Director and Vice Chair of Emergency Medicine at Frederick Health Hospital, where he leads a large team of physicians and APPs and helps drive high quality, efficient emergency care. He also directs clinical content for Full Code Medical Simulation, which is a virtual simulation platform used by clinicians all around the world, and completed his emergency medicine training at the Harvard affiliated programs at Brigham and Women's and Massachusetts General Hospital as well. So, Josh, great to have you here. Excited to chat with you today and ask all things medical.
Thanks so much for having me.
Awesome. So, I want to learn just a little bit more about kind of like what got you into medicine and where you are today.
Absolutely, yeah. I would say what really kind of drew me in was my early experience in medicine as a kid. I had asthma and I had food allergies growing up, so I wasn't a stranger to going to the hospital, being seen in the emergency department. Thankfully, not too often, but it did happen. And I got that exposure very early on that as opposed to being a scary place, a place where it was chaos and you didn't know what was going on. It was like a place of comfort. It was a place where someone took care of me and they helped me feel better. And that was from an asthma attack, which happened to me once on Christmas, or from a allergic reaction. And I just sort of got that exposure and got my interest piqued by, this place where, you could go and they would help you and they knew what to do in any kind of situation, and you would, feel better and they would take care of you. So that was sort of the beginning for me. And it just grew from there over time, as I got older, into me wanting to be a doctor and specifically an emergency doctor, especially because of those experiences as a kid.
Amazing, amazing. Yes. I feel like working in the medical field, you probably, especially emergency medicine, you probably never have a boring day ever.
I think that's very accurate. It is almost always different. You get just a different mix of patients on any given day. It could be all cardiac or all neurological things. It could be cuts and scrapes and broken bones and traumas of every different kind. There's just no permutation that is the same. And that's another thing that appealed to me, is that coming in and taking care of people fresh and anew, meeting people, helping them in a time of need, helping them feel better, saving them from something, sometimes just comforting them and not being able to change what was happening, but to have that opportunity in so many different ways to help people. There's so many flavors to how it comes. Every day is a different experience and adventure for sure.
What we really want to focus on today's episode are the things that everyday people can do that aren't medical professionals in the event they're out, whether it be grocery shopping, going to the mall, just like out doing their daily errands, and someone collapses, someone has a medical emergency. I think when we talked earlier, you said everyone can kind of be in some way, shape, or form a first responder and help potentially save someone's life while you're waiting for, emergency medical professionals to get there. And so today I really want your perspective of, what are things that people could encounter on their day to day? How do they navigate those situations? And what do those situations even look like?
Yeah, absolutely. And I mean, I think it's something that happens, over time to many of us. We're out somewhere and we, experience, the someone having a medical event and someone calling for help. And that can, take many different forms. Sometimes it can be, as simple as someone fainting or passing out, what we would call syncope. That's one of the most common public emergencies that someone might have, and many times it's not as serious as it might look, thankfully. Seizure is another common event that can occur, in a crowded area or somewhere where someone's needing help. But then, of course, there's also much more serious ones, where people might experience a heart attack, they might experience a cardiac arrhythmia, and really need life-saving treatment as soon as possible. in order to have some chance of making it through. What we wanted to talk about today is really just what you can do and bring, even as someone who is non-medical, to bring that person help and to give them aid, and give them the best chance if they experience a really serious medical emergency in public.
Best.
Yeah, no, absolutely. And I think, if someone without medical training is, coming upon something like that, the first thing is just to lend help and to ask what's going on, to assess if they're responsive, if they're awake, if they're breathing normally. And there are many situations where they are, whether it's falling and hitting their head, whether it's passing out briefly, and then coming to, really just stepping in and taking action just to ask them if they're okay, and then to activate an emergency response, and try to do that as quickly as possible in tandem with that. And so, in the US, that's 911, and it may vary in different places around the world. But, just jumping to that simple action of, are you okay? Making sure they're awake, that they're breathing normally, and activating response can be the world of the difference in many of those types of emergencies. And you don't have to know exactly what's going on. You don't have to know exactly how serious it is. You just have to get that machinery rolling to get some additional professional help to them as quickly as possible.
Assuming we're going into a CPR scenario, and I think that can be a common thing that maybe the everyday person might be exposed to, and might be an opportunity for them to lend help. What would be the first starting point for that individual if they're going to engage in that?
Yeah, yeah. No, absolutely. I mean, that's one of the scariest situations that you might encounter. Like I said, there are many situations where the emergency, it might be brief or self-resolving, and that can be the case with fainting or with seizure. But there are also times that someone's going to have a potentially life-threatening event, such as a heart attack or an abnormal heart rhythm or some underlying medical emergency that results in a cardiac arrest. And if that is the case, someone who is not responding, someone who is not awake, who's not breathing normally, the first thing that you want to do, is act, as I said, to check on them, to see how they're doing. And that really takes two primary components. Assess if they're responsive, shout, are you okay? If their name, if you know it. And then second, are they breathing normally? Those are the key elements of just assessing in the initial. If you're trained to do it, if you're trained in BLS or you have experience, you can check for a pulse. But if you're not sure and you're not able to find a pulse, you shouldn't spend a lot of time continuing to check before you just start performing CPR. And we'll talk a little bit more about how that works, but those are the first steps. And in tandem with that, you need to call for help. And that could be you picking up your phone and dialing at the same time, putting on speakerphone and assessing them at the same time, asking someone else to do it, and really making sure, you call 911. I'm going to check on them, and making sure that is happening, that they're seeking that and getting that help moving while you're trying to assess them.
I think that, I've been in public when someone has fainted. They did wake up. But I think what I oftentimes see in these types of situations is kind of like that bystander effect of everyone thinks someone else is going to jump in and take action. Oftentimes, I mean, for example, I was with one of my really good friends who was a paramedic and like worked in the medical field, and she instantly jumped up and went over to her and began assessing. And I think that, a lot of times people, when they're in those situations and something does happen, they think someone else is going to handle it, or there's someone there that's more equipped than they are to handle that situation. And that can result in someone either living or dying based off of the action that's taken. And so, are there certain scenarios where someone who kind of goes into that, I'm going to let someone else run with this or take matters into their own hands, things that they could do to kind of overcome that? And what does that timeline look like if you don't see someone spring into action? Like, when should you be like, okay, I got to take matters into my own hands now, I guess?
Yeah, yeah. I mean, that's a great question. I think, first let's talk about, a really serious situation, a situation where someone needs CPR or resuscitation. That time is so critical. Every minute that goes by, survival continues to drop and drops very quickly. And even after about 4 minutes, you start to have brain cells dying. And that's why it's so important to have someone helping and rendering aid while you get additional resources and you get professionals there. So like I said, the really critical thing is to just remember the simple key things you need to do. Just go to them and check on them. Check if they're responsive, check if they're breathing normally. And if those things are not present, that is an indication then to start. And to every second that you save by going to them quickly and doing that is incredibly critical in that kind of scenario when there's a cardiac arrest.
Oftentimes hear a lot of people that are very reliant on AEDs being present, which they're in a lot of places. Majority of locations will have an AED, but the amount of time that it can take from the person going down to then another person seeking out and finding the AED could also be critical time in between that. And so administering CPR during that waiting period until an AED is present is probably another thing that people should be considering and not just waiting for the AED to arrive on site.
Absolutely. I think the really critical thing, especially when there is a cardiac arrest going on, is to start CPR and start some of that blood flowing so that you can give them the best chance at survival and get them on to a professional to take over. And so there may be times where you're in a place that an AED could be available. And that's the same kind of situation where if there's another person available, wonderful. Send them, say you get the AED, look for an AED, I'm going to check on them. And that can be, a lot of times concert venues or airports or, public spaces, libraries. Otherwise, like a lot of them have these now and will have them available and, a staff member or otherwise, or they'll be very clearly labeled. But yes, it's a great question. Like, you should not be, if you don't know where it is or you don't think you can find it, that's not, the thing that you should be doing if you don't have help. You send someone and you take care of the person in front of you until there's additional help, like a first responder, a police officer, a firefighter, and then an ambulance team that can take over.
Awesome. For having worked in the emergency room now for, I'm guessing, pretty much majority of your medical career, have you seen the difference of success in, people coming back and being able to just function in their normal day-to-day lives when there has been bystander interference and, they started CPR versus whenever, that either hasn't happened or people have waited, and what that difference in outcome really looks like at the end of the day?
Yeah. I mean, every scenario is different, and it's always a matter of, retrospect or wishful thinking, wondering how it could have gone better and been, and potentially even saved someone. But according to the AHA, there's about 70% of cardiac arrests occur in the home space, a home environment, and then only about 40% of the time do people get the necessary resuscitation and CPR started immediately before a professional first responder or medic or EMT arrives to take over and assume care. And that's just that absolutely critical portion where there's still oxygen in the body that still can be circulated by CPR and to keep those brain cells alive. That's really that is the critical thing. That's what you're doing with CPR. You can't replace the pumping of the heart. You can't push as effectively as the beating of a healthy heart, but you can move the blood flow along enough to preserve brain function and to get someone to to the proper care. And that's something we think a lot about in medicine. Is the very sad reality of CPR and resuscitation is that there are times where you can bring someone's cardiac function back, but it's been too long, and their brain is gone, essentially, and they've suffered an injury that is irreversible, and they'll never wake up or recover. And for us as caretakers, and for families, that is, a terrible thing as well, and you want to be able to, give someone the very best shot at what we refer to as neurologically intact survival. Because if you don't get that early intervention, you can still have permanent brain damage or never wake up from it, even if it's successful in restarting your heart.
No, that's good to know. And I think that, I guess my next question would really be if I'm out at a random place and someone does collapse, can you walk me through what, the steps that someone should take all the way through to administering CPR and kind of what that would look like from kind of like start to finish?
Yeah, no, absolutely. And I think, this is something that has changed over time and become simpler, as we learn more about what's helpful and beneficial. And so, absolutely, I can kind of take you through. We've talked about some of the initial steps, go to that person, right away, check on them, check first for responsiveness, shout, are you okay? Shout their name if you know it, and check if they're breathing normally. If they're only gasping or only kind of making gargling sounds or irregular breathing, then those two things, that's your indication to start. If you're trained, you can check for a pulse, but you don't want to be spending time, every second is precious, checking and deciding, if there is a pulse. You have to do that very quickly in tandem. And so at the same time that you're doing that, you're asking for someone else, you're specifically directing, like, you call 911, you look for an AED, if those people are available. And then, after those initial steps, as soon as possible, then you're just starting. And the emphasis has really shifted, to now what we call hands-only CPR in those very first initial minutes. And that's because of what I talked about. Someone who experiences a sudden cardiac event, in most cases, has oxygenated blood in their body. And you can buy a little bit of time by circulating that with hands-only CPR, so only compressions. And so for teens and for adults in that age range, that's the recommendation when there's no help available, when there's no first responder, no EMS immediately available, is to start compression-only CPR until you get that help to arrive. And of course, some people may be trained and they may be experienced in giving rescue breaths and performing basic life support. But that few minutes, even if you don't have that training, that compression only CPR can be absolutely critical. And so what that means is you're on the chest, the center of the chest, with two interlaced hands, and you're pushing forcefully on the sternum, on the center of the chest, down to a depth of about 2 inches at a rate of 100 to 120 beats per minute. And I think, when you see this on TV or in movies, especially because it's an actor, it may not be realistic in terms of what it looks like, but it's very forceful. It's very hard to do for a long period of time. You may actually find doing it after just a few minutes, you're wearing out from the force that you need to apply. And that's when someone else can rotate in and can help. And hopefully there's help arriving that can take over. But it is somewhat violent, and it is a lot of exertion. And sometimes, you can crack someone's ribs. You can feel that happening as you perform CPR. But you have to remember, this is someone who would otherwise die. And if that occurs, you can't really make the situation worse. That's to say. So, that's what you need to do in order to kind of bridge them to that time where someone can take over. So it's 100 beats per minute to 120, and a depth of 2 centimeters. And you're compressing the center of the chest forcefully and continuing that until help arrives. And if you're trained, for rescue breaths or other aspects of BLS, then of course you can, incorporate that as well.
And 2 inches, not 2 centimeters, right?
That's right. That's 2 inches. Yeah. So it's pretty
Okay,
forceful,
got it.
and you're compressing down the center of the chest pretty hard and pretty deep. It's also important that you allow the chest wall to spring back in between. You don't want to be maintaining that force all the time, because what you're doing essentially is providing some kind of modicum of a replacement for the beating of the heart, and compressing the heart between the breastbone and the thoracic spine, and pushing some of that blood flow forward and using some of that remaining oxygen in the blood to keep them alive and to keep the brain cells alive.
I think you made a good point that, and I know it's true for me, where a lot of people's exposure is through TV or movies or medical dramas. Are there any other misconceptions or things that people may think they have an understanding about, but really don't and should do it an alternative way in the moment, whether it was CPR or anything else that's top of mind.
Yeah, yeah, no, absolutely. I think, when we're talking about the realm of CPR, I think, some of the very common things are just, as I mentioned, like the amount of force and energy that you have to apply is just often a lot more than it looks like, in pop culture. And that's understandable because sometimes you're actually doing it on a real person and you wouldn't want to hurt them. But, the amount of force that it requires and the tempo is also really key. And so the speed a lot of times is really off, when it's portrayed in pop culture. We, genuinely in medicine, use songs and things that we can think of in a melody to kind of drive and remind ourselves of what pace we're supposed to take. And it sounds a little bit dark. We do love a little dark humor in emergency medicine, but it really has a genuine purpose, which is to keep you at that pace, because it's very easy to slow down as you tire or to lose track of it. So people, the classic one is Staying Alive by the Bee Gees. That one, you got a little bit of dark humor in there, but that helps. That's the right tempo to keep you on beat and to keep you up to the speed that CPR requires. And you've got some other options. You got I Will Survive, also a good option. If you needed something more modern, Uptown Funk, I was looking this up, is one as well.
I think one of Sabrina's
Yep,
Carpenters,
yep,
maybe
espresso. Yep,
espresso.
espresso is a
Yeah.
good one. Yeah, yeah. So you got choices, and I know it sounds a little bit grim, but it really does serve a purpose. It allows you to sing along in your head and remember how fast you need to go, because it's very, very natural to slow down slower than you should be going, and that can lead to ineffective CPR. So that's why we kind of use that as a mental metronome to keep us up to pace.
I think that when I went through CPR training, one of the most like shocking things to me, because at that point had only ever seen it done in movies, like I've never witnessed real life CPR. And one of the most like interesting things was just how important the chest compressions were and not the rescue breaths. Like being able to really focus on only the chest compression aspect of things. And like unless you had, for example, and you can kind of go into like the mouth cover that does exist. You could buy like them off Amazon that you could like place over someone to help keep you safe as well as the other person, because bodily fluids can be exchanged. And so you don't have to necessarily go into the rescue breaths thing if you don't know the person or whatever the situation may be, or you just don't feel comfortable doing that. And you can still save someone's life solely just doing the chest compressions.
Yeah, and that's, I think there's a very important distinction to make there. If you have the training and you have the ability, rescue breaths and providing additional oxygen can be additionally helpful. And in the hospital context, we're using a bag valve mask over the face, or we're performing, a definitive airway. We're putting an endotracheal tube down the throat so that we can do continuous compressions at the same time. But importantly, we're really trying not to interrupt those compressions regardless of how we decide to provide oxygen in the airway. But this is later on in the course of a cardiac arrest, and that's why it matters. So when you're very early, though, except for specific situations, which I can talk about next, generally there's circulating oxygenated blood in the body until the moment the heart stops. And then it's no longer beating and beating forward, but there is oxygen present in the body that can still be used, and most importantly, by the brain cells if it's circulating through. And so that's the purpose of compression only or hands-only CPR, is in those early minutes, you can help them and you can continue to allow the body to use that oxygenated blood and extract that oxygen until there's more help, and then you can provide supplemental oxygen or advanced airway management, the way a professional would. But those first minutes, it is really critical that just the compressions can save someone's life. But if you have the training, and you have the ability, then you can certainly, consider doing, rescue breaths as well. But in those first critical minutes, the circulation is the most important.
Can you explain a little bit how that timing works and what's effective and really what stops being effective?
Yeah, absolutely. I mean, and this gets into, there's many different medical scenarios where you depending on what's going on, it may be, easier or harder to restore circulation. One of the reasons that we use an AED is we try to identify abnormal rhythms that could be flipped back into a normal rhythm. So, patient may be experiencing ventricular fibrillation or ventricular tachycardia, so the heart is not beating normally, but it's beating in a way that you can shock and flip back to a normal rhythm and sometimes end that emergency. And that can be because the arrhythmia started, for whatever reason, for an underlying medical reason, or because of a heart attack, sometimes. And those are the situations where it's especially critical to get that help to them quickly, because if you can abort that rhythm, while you're doing CPR and you're setting up, sometimes you can get them back very quickly within a few minutes. It's close knit, you're inside, there's cameras everywhere, there's AEDs, there's security, and they can get to people really quickly and intervene and try to reverse what's going on. But there are also times where there's a medical issue that's causing it that makes it more complex, and that can be a massive blood clot in the lungs. It can be electrolyte abnormalities. And those things, potentially we can address, in with EMS or in the hospital context, but not always. And then, your question did spur, some thought in my mind too to some of the extreme examples that some folks may have heard of. But, in a situation of being hypothermic or severely cold, there are instances where it can be effective for, an extremely long time. And that's someone who maybe fell into a frozen lake, or was, submerged into ice cold water. They can sometimes survive for a very extended time with CPR. And come back neurologically intact because of the changes that go on with the deeply cold temperatures. Yeah, no, and that's a great question, and it certainly gives a lot of people, pause in rendering aid. And that's, motivated, to be honest, some of the change around focus on compression only or hands-only CPR. Hands-only CPR is, someone that can be done by anyone, for, any adult or teenager is recommended, that it be performed if there's no one else available, who has the skills or is CPR certified. Critical minutes when you're trying to get that help, that additional help and resources to them. Anyone is capable of performing it, and using that structure that we talked about. Assess for responsiveness and assess for abnormal breathing, and then go. What if you're wrong? If they pop up and push your hand away and say, "Hey, stop that," that would be wonderful news, right? But if they don't,
Yeah.
You're doing something that can really save their life, because maybe the ambulance is 8 minutes out, 10 minutes out, and if people sort of stand and hope that something else will happen or someone else will step in, that may be, all the time that person has to, to successfully survive that event.
No, great point. And for everyone listening, because I do think it's so important to get CPR certified. It's such a great skill to have. And so for those that are interested in getting certified in CPR, what resources are available to them and what can they do to make that happen?
At a CPR certification, I would really encourage to explore that. There's local classes available in almost any area. Some are kind of mixed online and in person, where you can do some training online and then finish it off in person. Regardless of where you are, your hospital, local EMS or fire may offer some kind of education like that. And it really encourage people to gain those skills, because that also teaches the proper way to resuscitate a child or an infant that's experiencing cardiac arrest. It teaches you how to deal with some other emergencies like choking, like opioid overdose. And, if you can bring those skills out into the world, you can be that person that really makes a difference, if you happen upon somebody who's experiencing a medical emergency.
No, great information. And we'll attach the links in the description to just some basic CPR classes that you can sign up for that are in everyone's cities, as well as the American Heart Association, who's the big one that puts out a lot of training and the standards. So we're going to list all of that in the description as well so that everyone else can access it. But thank you so much for coming on the podcast. This was super informative, and I hope everyone took something away on the importance of going and just acting and not waiting for people to take initiative, and you just might save someone's life.
Absolutely. Yeah. Thank you so much for having me, and everybody stay safe out there.
Thanks.
Great. Thanks, Doc.